Good afternoon and welcome to the COVID-19 Learning Community Meeting, hosted by the COVID-19 Command Center and powered by the Joint Information Center. By default, all participants will be muted to minimize distractions. For Q&A, please use the raise hand function at the bottom of your screen. When called on, please unmute your microphone to ask your question and mute your microphone when not speaking to minimize background noise. When speaking, please announce yourself and speak slowly. You can also enter your questions or comments into the chat panel. Please hold all questions and comments until after the presentation portion of the event has concluded. Today, our meeting objectives are as follows: to review the current state of SF pandemic and local indicators of hospital capacity, disease situation, and disease control and current pop-up testing efforts, to share outreach strategies that are working to increase participation in community-based pop-up testing events, to describe the launch of the new SF social marketing campaign promoting masking and prevention. As we approach Labor Day weekend, remember to keep yourself and others safe. Remember to wear a face covering and be sure to wear it properly. Have safe social gatherings, keep at least 6 feet of distance, don't share any food, drinks, or common objects, and gather outside whenever possible. Be the trusted messenger by discussing with your family and friends about how to gather safely. Community safety is a community effort. Our agenda today is as follows. Geoffrea Morris will take our welcome and housekeeping, followed by the COVID-19 status update and testing calendar presented by Dr. Fuchs. Geoffrea will go over outreach that works and our lessons from the field. Tyrone Ju will present promoting masking through social marketing, and Geoffrea will close us out with our next steps. And Geoffrea, I turn it over to you.
Hi, good morning, community. So as you know, we're like at our 4th week of doing these community meetings, and we decided to kind of stick to 1 o'clock, 1 to 2. I know one time we did try to do 2 meetings, but the 1 to 2 will continue, and we've changed kind of the format a little bit different to be called the community learning event. So every Friday, we will be going over testing results, impacted areas, and then we'll be covering different aspects of the whole COVID Command Center. Last week was a really good discussion with Dr. Gandhi on masking. And this week, towards the latter part of this conversation, will be about our joint information and marketing campaigns that we're launching in the city. I want to give you all that next week we will be covering learning zones or learning communities and school reopenings. But thank you all for your patience, and I look forward to talking to you in the next 15 minutes as we talk about things that's working and things that's not working with our community testing. This segment is also here to ask community, those who have done community testing in the area, what has went well, where what has not, and how can we further improve on these community pop-ups. As you can see, it's been very robust. I've worked really hard with the community testing division of the CCC to really spread out and working really hard to get this whole month calendar. So it is a lot of moving parts. And because I've heard you, one of the things, Dr. Moore, I seen you said the community needs more advanced notice. So, but I'll start with you, Dr. Moore, because I know you've done several sites and providing a lot of insight as we continue to work out the kinks. And then I would ask for other community members, you can raise your hand or say call on me next, Geoffrey, in the chat, and then you'll be up. So Dr. Moore, can you unmute yourself? And if not, sure, I'll find you.
Sure, yeah, can you hear me, Geoffrea?
Yes, ma'am.
Yeah, okay, thank you, Monica. I see you nodding. Hi, everyone. Thank you, Dr. Fuchs. Thank you, team. So, you know, I sound like I'm irritated and passionate, but I'm just passionate. So I wanted to go through a few things. I mean, I think at this point I've probably done 25 to 30 testing days in the community. So, you know, we kind of know, you know, we know the drill. So I put some of my questions in the chat, and this one is for Dr. Fuchs. I mean, I think that the number, the N, is too low to really tell what's really going on. When I look at those numbers, the only one that's really more robust is in the mission. So I wanted to, and also Sunnydale, where we've had consistency. So we've been stable, we've been able to get the word out. I talked to D'Anthony this morning. I was at the African American Arts and Cultural Center for an hour or so this morning to see what was going on. And again, we're not reaching everybody. So D'Anthony and I talked about strategy for that and what we need to do, but it really takes consistency, it takes community partners, and it takes getting the word out for those trusted community voices. And then I think we also need to be able to be mobile. So what would be interesting to me is to be able to have another tester that could go out to, say, like the senior center over in, let's say if we're at the African American Arts and Cultural Center, to take a tester over to the Davis Center that's over there in the Western Addition, and, you know, get those folks signed up, or better yet, go and get the seniors on another day. But we seem to not be getting the word out over on that side. So I think on the side of the city, the southeast side of the city, people are kind of getting more familiar with the idea of getting tested, so that's great. But we also have to get the right people out. So after this weekend, I'm gonna be concerned that people are gonna be doing their, you know, their family events, their barbecues, their parties and all that. So we have to kind of see what we can do right after, as Drew made the point on another call earlier, you know, kids, you know, will be passing the blunts to each other and sharing drinks and getting close to each other. And so we really do want to make sure that we try to get tested next time, because after the Memorial Day last time is when we almost had our outbreak in Sunnydale. So we want to check on that. So I had that question for you, Dr. Fuchs, and also, is the testing and the mission disaggregated by race? Are we reaching the people? Is it just people that are showing up because they know it's consistent, or is it the actual people that are living in the community? And then the other piece, you know, I'm still harping on this script that we need both pre and post, because I don't feel like, I still didn't hear anybody tell me today that I could have resources if I tested positive, not one person, because I tested myself again today. So that's the fourth time. Nobody has told me that there's community resources. So we need to make sure that that word and message is getting out, and it's not. And I observed other people being told, and nobody else was told that as well. So I wanted to just kind of harp on the point that we need a universal script. I think the letter that you talked about is great, but I think it needs to also be told verbally, because people will get a piece of paper and not look at it necessarily. So I think those are some of my questions for now. And again, it's just the stability. So I can't really think that we're going to be able to drive the conversation by where the positives are if we don't have enough people tested. That's my main point, if that makes sense.
Sure. So there are a lot of questions there, Dr. Mo. Thank you for all those great comments. I'm sure I'm going to miss a couple, but I'll do my best. And I'm looking at the chat also about other things that you mentioned here. So in terms of, so I'll start with for example, at the Mission Hub and the testing there. We do have data, and I've presented on prior calls, and I can try to present more of that data on future calls. Just trying to also think about the time, and want to make sure we have time dedicated to other important topics. But for example, from the mission testing, when we've looked at this previously, people are coming from the mission, and they're also coming from the Excelsior, where in terms of the testing. So we are able to get some of the data. Again, we're missing a lot of zip code data, and we do miss some race ethnicity data because it relies on people disclosing that information. But when we do, whatever data we do have during the testing events, we can look at that to see who's represented in the pool from those events. So that would be the first point I wanted to address. I think in terms of your the comment about the pre and post test counseling, we talked about that, and you brought up that issue, that important issue when we were focusing on testing minors between the ages of 13 and 18. And I know there's a working group within COVID Command that will be partnering. If there are others on the call that want to talk about that, to be able to share some of those scripts. There's an SOP that I know that's in development. I saw a draft of, so bringing others to kind of look at those and make sure that, I think, again, the consistency of having the same messages that are being shared with everyone, I think is really important, about what resources are available, about the importance of isolation and quarantine, so that if people do test positive, that they're not coming to get food resources at another location, for example, that they can.
Yeah.
And please.
No, I thought you were done because you hit mute.
Sorry about that, Mel. My dog was starting to bark, so I didn't want to make some additional noise. I apologize. Yeah, I'll stop there if you wanted to make an additional comment, Geoffrea, and if you have other questions, Dr. Mo, I'm happy to answer.
I just think that, Geoffrea, can I just say one last thing? I mean, it probably won't be my last, but I'll try. The thing that is important to me for us all to understand is that there is a complete breakdown in how African Americans and other groups are accessing the right to recover. We're not accessing it. You know, the data that I heard, 98% is Latinx that's accessing the right to recover. So we are not being told about it, we are not accessing it, and we are not getting the contact tracing calls. You know, as you heard from Uzuri the other day, people are not getting the message to the community, is not making it there. So they're not able to find out who that person was around and to call them and tell them to go get tested, all of that. They're not getting the rights to recover, you know, of the financial piece. So all of that, and then also it's driving it's also driving, if you are sick and you need help, you know, to stay home or to access the hotels or to access, you know, food delivery or, you know, cleaning supplies or, you know, Tylenol, none of that is getting access because there's not the pre and post test counseling. And then it's also the data from Colors is being told to the Latinx person at that's working. And I told Director Colfax Grant this last night. We're not getting any information. They will not release the positive to the Black people. I'm just going to be direct. You know, they're not telling us in community DPH staff, community African Americans. They will not tell them who's positive so that we can make sure that we get the results to the community. So you have a breakdown in, you know, racism by proximity is all I can tell. And so we have to fix that problem because otherwise we're not getting the access to the resources and people aren't getting their families checked if they need to get their families checked and on and on. So there's a whole potential epidemic happening that we don't even know about unless somebody gets really, really sick. So, and I'll stop there. Thank you. And I'm sorry, that should be, you know.
Can you all hear me? Okay.
Yeah.
Dr. Mo, no, we understand there was a breakdown regarding the color pop-up sites. And I spoke to Dr. Bennett and the African-American staff that you were mentioning with DPH. We've been able to correct that. And that was not intended. It's just other people had a resource and was able to access the resource, and some of the African American staff weren't aware that they could access it. So we did correct that, and that should work, and we should know the results faster. But please tell me if that's not happening, because I did work on that, and as Dr. Fuchs stated, we are setting up the protocol of pre-test, post-test for all these sites, and we are hearing you. So please note that we did talk about that this weekend and try to even streamline the process regarding testing, not just in our color pop-ups, but throughout. Like if people go to Kaiser or the General and different things. So I'm gonna call on Kathy, and then it's Mike, and I think it's you, Kent, after that. Go ahead, Kathy.
Hi, everybody. I just want to say hi to Aaron Yen. We've worked together on other community stuff for years and years and years. It's great to see him on the call and know that he is being assigned to District 11. So I think we need to set up like a joint Zoom meeting with Maria too, so we can kind of discuss some things. So I do have some ideas on how we can improve outreach and engagement in the Excelsior, not just Excelsior, but Outer Mission and OMI. I am going to be bringing a group of high school youth to get tested on Monday myself. I have a child who attends June Jordan School of Equity. I do think that doing outreach at Burton, Balboa, like using the public schools to be able to engage families, and so their parents might be a little more trusted to get their parents out into the testing. SFMTA has kept the 8 San Bruno, which runs, it serves, Bayview and Visitation Valley, and it connects with the 14 Mission. At Mission in Geneva, there's still about 6,000 transfers happening daily there. It is really heavily used bus lines. So perhaps we could be using buses with pre-recorded messages in different languages, and also with imagery, like have the Rona imagery that was created and used in the Fillmore and used with the community caravans, have that on the buses, have, other culturally specific messaging on the buses, and that might be helpful as well. I also think we've got that Crocker Amazon is a great location because that's where the testing is on Mondays, because you can get across the park from Visitation Valley and you can get there from the Excelsior. But we have had a lot of people ask to have a different location because Mission Street in the Excelsior runs from Silver to the county line. It's over 2 miles long. So if we could figure out a way to get something closer to Mission, there is a lot of activity on Mission Street just on the daily basis of doing your work and buying groceries and going to the bank. I participated for 6 weeks in community caravans and stood on the corner of Mission and Ocean Avenue and would hand out 1,000 masks in about a half an hour. So because you got like 5 banks, people are lined up outside the banks. They're like, getting ready to, and it's very multicultural, and we definitely would be able to do outreach and engagement to people who we are absolutely trying to connect with on this. So, I mean, there are ideas and ways that we could be doing more engagement. And I do think in the Lakeview, the community caravans work really well if you can stop and if you can stop and hand out, and be in a spot for a few minutes handing out masks and then leaving. Also in the Lakeview, I know that we were working with Renard Monroe with Youth First, who has really good connections with the principal of Sheridan Elementary, and it would be great to be able to maybe do some specific things where we're working with the families from that school to, like tying things in with backpack giveaways or whatever to get people to the hub. And I have to totally, just recognize EJ Jones and the group, in the Invest Black group, because they've done a really good model of having census, having voter registration, having meal pickup, like really making it a hub for people to come in and get tested. But, I think that those are my suggestions anyway. There's more we can do.
All right. I want to say something you said, about the Mission Street corridor. So Maria and Monica have been looking around for that because we did hear that concern of having also a pop-up on Mission Street. And so that's something that we are working on. And as Erin comes on board, hopefully we can do that. But I'll definitely, I'm looking to do an Excelsior D11 type meeting sometime next week, if not the following week, to kind of talk, because we were also looking to kind of add more days to the Excelsior site. So I'll keep you in the loop of that. And then Monica's in the chat. So then, so I want to go to the next one. Thanks, Kathy.
Thanks.
And so the next people, if you can just say it like in 1 minute to 2, because I want to get to everybody. And I see Sam, I missed you. So Sam from the Tenderloin, can you come out?
Sure. Just a quick question. We had a call last week about strategies in the Tenderloin, and we had lots of questions about, do we go building by building? Should we target particular populations? What are some of the strategies? And so the big questions were, is there any guidance from DPH on kind of like where to target our efforts the most for the to get the best data for our community? And then also, what should our target number be over what period of time? Should we really be X number per 1,000, or should it be X percentage? How do we gauge for ourselves whether we're doing an adequate job?
So Sam, I'm gonna let Dr. Fuchs come in after me, but I know like every time we send a color site out, that is at least 250 tests. So we would like to use all tests at pop-up sites. We have been doing the community-based organizations that I've been reaching out with and working. It's been some neighborhood specific, some ethnic specific, just to increase outreach. I haven't seen a targeted number, but I know that when we set up a testing site, we want to run out of tests so that we get a good sample size of who's impacted. Latino community is 8 times more likely to be impacted from the tests that we receive in data. So that is, that group becomes a target, but we're also looking for other marginalized communities that have been under testing. So the Asian community has been under testing, the African American community, and so forth. But Dr. Fuchs, I lean to you to maybe add a little more context, please.
Absolutely, sure. I'm going to show this slide again. So these are excellent questions. And I think what I really appreciate about this is really an invitation to have a conversation with individual communities and thinking about neighborhood and then where we're seeing infections. So these are data that we're getting from from case investigation and contact tracing, and from our overall view of positivity in a specific neighborhood. And these data, for example, are looking at test results not just from color, for example, or not just from our alternate test sites, but these are from folks who are testing from a variety of sources. So let's look at the Tenderloin, for example, because we have several census tracts that are noted here. So for example, in this census tract where we're seeing 12.42% positivity, much of that positivity is being driven by those positives are being detected in Latinx clients. But we also see a significant number in Asian clients as well. So this would require us to really think about and to look, based on the case investigation contact tracing data, we can try to see where some of those infections are being detected for us to think a little bit more about our focused outreach. And I would say the same thing as we go through each of these census tracts that are heavily impacted, for us to look at where those infections are being detected, and then for us to be able to do a little bit more of a deep dive so that we can focus our outreach strategies. So I know that's kind of a broader answer, but we'll use these data to help inform how we'll be able to do our best outreach.
Just a quick, see if I just need to push you just a little bit. We have the tests per 1,000 number. And again, it sort of feels like it should be useful on some level to be able to say we have a target of, say, over a 30-day period of time of 50 tests per 1,000 or 100 tests per 1,000 or 10. But, to kind of give us a benchmark that allows us to know how much harder we need to push, as well as, because I get the thing of like, we want to use all the tests we've got, but that doesn't necessarily tell us what we need for the population we have.
Right. So, it's a great question. We're actually developing those criteria right now in terms of what that will look like. But in general, the overall hypothesis that we have here is if we focus tests, a substantial amount of testing within a particular census tract, and then not only test, but actually those people that we find are positive, link them to isolation and quarantine, that will help to contain infections. So that obviously on top of what needs to be happening around prevention. So what we're doing is we're developing criteria, and that will help guide the amount of testing that needs to happen over what period of time, to be able to say that with enough coverage. And I gave an example, 25% of the population that we're trying to reach in that specific census tract. So we're using those as guides to help us to determine how much, how often, and for how long that we need to do testing. So more to come on that, but we'll give you more information as we continue to vet those criteria.
Thank you.
Thank you, Sam. Okay, it's Mike, then it's Kent, and I think we're gonna end with Veronica, because the JIT will be up next. Go ahead, Mike. Mike Vaughn, Tenderloin.
Sure. Thank you. I'll try to make this really fast. I'm just curious, like, are we tracking how many people are retesting versus testing for the first time? I mean, obviously we want as many different people to test, but retesting is also really important. The next question is, again, for transparency and as easy as possible, is there a document or website that says if you test positive, these are all the resources available to you, your supervisor should be able to do this for you, yada, 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 with like links and all that good stuff. So just curious.
Geoffrea, I'm happy to make a comment on the first question around the retesting. So we have looked at this periodically in different sites. So for example, one site, this was a few weeks ago, we looked at retesting at the Embarcadero site, and we saw that about 11% of people had come back for retesting. So looking at what we're most concerned about are the people who are positive who came back to get retested, because again, we're trying to prevent that from happening. So we're going to take a look at that. That's a specific data request that we can give to our advanced planning group to try to explore that a little bit more deeply, and then to look at that across multiple testing sites. So thanks for that question. And then Geoffrea, please feel free to add to this, but we have a number of helpful resources on our website. So I think this is just a good call to action for us as for Central Command about how do we package those and get those out to the community. But lots of great flyers, and the JIC will be presenting shortly and can also comment on that as well. But thanks for the question. I think it's really important. I think you're highlighting the need for us to step up our game in terms of even getting more of those resources out to.
No,
Yeah.
thank you, Mike. I also reach out to the JIC because I think it should be easier. Like I'm asking for like a community tab where you can kind of click in from the work that we're doing here and kind of follow up, as well as somewhere to like the masking video that we had last week to live. Because we're looking for this to live where community can be easily accessible. So we are working on that, and I did pull that out too because I've heard that in similar conversations. I want to call Kent Wu from Chinatown.
Hi, so I was just curious for the training of the contact tracers, if there was a cultural competence component to it. There was recently 10 case positives in an SRO in Chinatown, and when the follow-up calls went to them, none of them chose to be quarantined, and some of them were still expressing concerns about losing their jobs, others not knowing where they would be placed, and then a lot of them also saying that they heard that the food where they were going to go would not be good. So just wondering how the message is being delivered to them, how they're being sold on, in these cases, very critical situations where they be removed from the premises so as not to be a spreader.
Ken, I think thank you for your question. I think it would be great, I think maybe for one of our future sessions is to have someone from the case investigation contact tracing team to talk a little bit about the training and for folks, but there's a substantial amount of training that goes into for both case investigators and for contact tracers, and there is a focus on cultural competency, but to make sure that we were able to get information from those who are responsible for overseeing that program to give you some of that information firsthand. But thanks for your question. We'll definitely take that down and we can talk more about that.
Great, thank you.
Kent, I know like when I attended your meeting, I brought that up, and we've actually, Lonnie, who's on here, I think Lonnie's on here. We're talking about like the problems with the food, as well as another thing that you brought up is that people want to know at least the area where the quarantine hotel is located.
Yep.
And that information was kind of, people didn't want to go across town too, what else I heard too. So we are definitely kind of working on this stuff. It's just, it's so many moving parts. So hopefully next week we can have a clear cut of this, because this goes similar to what Dr. Mo is saying too, post-test, and the post results part as well too. So
Yeah, that'd be great. If we could see the script also, that'd be wonderful.
thank you. I'm taking notes as we go.
Geoffrea, I'm here taking notes too. I am on the call. Thank you. And thank you to Ken.
Thank you.
You did talk to the food security. I know I missed that meeting about people complaining about the food in the quarantine not being culturally competent. Did you know that?
Yes, I did. And I gave the example of what was going on in Chinatown, and I followed up yesterday. And as far as their, hold on one second. I just ripped my headset out of my head. As far as they're concerned, they thought they resolved it, but it sounds like they haven't. So I'm going to follow up.
So yeah, because we were working, and Ken, I want to let you know, I heard you when you said it was too much milk and dairy products in there. So I want everybody to know, if I'm in a meeting with you and you complain, I really write it down. I take no offense and try to work on it.
And Geoffrea, I can, or Kent, if I could talk to you directly too, to get like the play-by-play detail, so that I'm communicating the play-by-play detail. I was communicating it at a high level, but clearly that's not good enough.
So
Okay.
I'll loop you. I'll put you two in an email, the three of us, and we'll kind of troubleshoot it offline.
Thank you, Geoffrea.
I want to give the jig. I'm sorry, Tyrone, I took 2 minutes in your things. So hopefully that's not a lot. But I want to call up Tyrone Jew, our amazing Tyrone Jew of our joint information team to move to the next part. Thank you, everybody.
Thanks, Geoffrea. And I'd love to be part of that conversation with Kent too. We're actually doing kind of a focus dive on how we can improve people wanting to use the INQ through kind of community outreach and kind of early education. So I'd love to be part of that conversation as well.
All right, I'll thanks.
Great, thanks. So just to introduce myself really quickly, Tyrone Jew. I am usually the senior policy advisor for Mayor Breed. During the COVID pandemic, I've been reassigned to COVID Command and been serving as the Joint Information Section Chief. And so the two groups that I oversee are the Information and Guidance, that's producing all of the guidance on how do we kind of safely do activities within a city. And then the second is the Joint Information Center, which is responsible for the outreach and information dissemination for the city. Let me just pull up and share my screen really quickly. Can you see the slides now? Always got to check. Okay. So broadly speaking, since the beginning of the pandemic, the Joint Information Center has, like I said, been really responsible for kind of the broad dissemination of information. So everyone by now has probably seen the blue and yellow posters, either posted in businesses or around the city. And these were kind of the first broad outreach just to alert and educate people on what needs to be done during this pandemic to protect themselves and protect others. This was obviously translated in multiple different languages, so not only just the threshold languages, but close to a dozen languages for almost all the different outreach pieces that we've done. The team has done buses, bus shelters, billboards, social media, door-to-door canvassing, and I think all in total, our field outreach team, which is made up of librarians and people who are just like disaster service workers, have distributed almost 3 million pieces of information since the beginning of this pandemic. And so they're out there every day, kind of working throughout the city. And that was kind of the start, right, was to get that information out broadly. And similar to what the conversation you've been having with Dr. Fuchs and the testing team around being more strategic and targeted in how you conduct your testing, you know, we always like to be more strategic and targeted around our outreach also, and going where the data is pointing us to go to, where there might be higher cases or there might be issues that we need to educate the public more on in order to kind of appropriately allocate resources and time and effort. And so in addition to all the data from a public health standpoint, which obviously is one of the biggest drivers of where we choose to focus all of our outreach. So we look at, you know, the demographic information, neighborhoods and populations that are impacted. You know, we also have been doing field surveys of different neighborhoods to look at what is the face covering compliance, because when you think around the purpose of the outreach, and one of the biggest things we can do to slow the spread of the virus, it really is the individual actions. And that's kind of what our team is trying to promote as much as possible, is how do we get people to take the actions that we know are out there? So the face coverings, hygiene, safer social gatherings, those messages, how do we get that out there to the community? So this work being done by our advanced planning team has given us good insight into seeing what parts of the neighborhoods, what neighborhoods have lower rates of face covering compliance, right? And so you can overlay that with where we've also been seeing spread of the virus to kind of triangulate where we need to have more attention and focused outreach. As I said, all of our outreach is always going to be citywide, and then we then do targeted outreach into our communities. So this is an example as we were going into Labor Day, that we wanted to have kind of a citywide campaign of, you know, basically getting the word out around masking before the Labor Day weekend when we know people are going to be out. This campaign launched on Wednesday with Mayor Braid making the announcement with all of our community partners into the other community campaigns that we're gonna mention. And you know, I really do want to emphasize that, you know, we're only one piece of the puzzle. You know, all the work that all of you are doing within the community is such an important component of how the word is brought to the community by trusted messengers and in a way that resonates and is culturally competent. And so this next phase, instead of the blue and kind of the yellow campaigns, we're really starting to work with our community partners to develop kind of direct neighborhood campaigns in a style and language that hopefully can resonate within the community to encourage action in those areas. And so the next couple slides are just examples of what we've launched going into Labor Day weekend. That was kind of our big target before the 3-day weekend. This campaign focused on the Latino community, was done in partnership with the Latino Task Force. And so this is actually the second part of that campaign. And so our great partners there, Susanna, Valerie, John, like, you know, we kind of brainstorm like, what are those messages that will work? How do we do the illustrations? How do we do the colorings in a way that actually people will respond to? And what's the tone? And this was the tone that they agreed upon and that we kind of worked with them on refining. And now this is going to be all over throughout the city in all of our various neighborhoods, but obviously within the language. We also did one focus with the African American community. And for this, we work with the African American Art and Culture District. So Evan has been a wonderful community partner in helping us to establish the message. Again, tone. This is about like, how do we convey the message? And this was what we kind of landed on that we believe would be very helpful going into Labor Day weekend and going forward in terms of the focusing on the familial aspect of encouraging the right actions and doing the right thing. This next campaign is something we did that we're launching within the Chinese community. And for this, we worked a little bit with self-help for the elderly, and we're going to be expanding upon this in the coming weeks. And this next campaign is one that we focused on with the LGBTQI community with the Sisters of Perpetual Indulgence. And so you can see like each of these campaigns is completely different from the other. And that's actually okay, right? Most people are more concerned with like the branding, overall branding, and that's not the purpose of these campaigns. The purpose of the campaigns is how do we inspire action within different communities, knowing that everyone receives their message differently, and who are those messengers that can deliver that. And finally, we've been doing a lot of work trying to focus on our youth. And so I heard Kathy mention, the backpack giveaways. So my team was putting together, all the care packages and information that were going into the backpacks that are going out to the learning hubs and being distributed out to all of those kids. And we're using artwork developed by the community. And here our partner was the Opportunities for All program. and DCYF. And I think going forward, we're going to continue kind of looking at different neighborhoods. Our next target neighborhoods are going to be the OMI and Excelsior. So definitely love the comments and ideas I was hearing there. It doesn't mean that any of these other campaigns just stop. It just means we've started kind of coming up with a theme, and we're going to continue building upon that going forward, and that we continue moving around the city and working in partnership with different community organizations to scale out based on the need and where the data is pointing us to go. And with that, I'm happy to answer any questions.
So Tyrone, one of the questions is, like, people are really loving the work, and I appreciate you all. You all work so hard. How, you said different organizations you're working with. Should individuals reach out to those organizations or to you all?
Yeah, the organizations, I mean, there's lots of ways to get in touch with us. So you can obviously go through Geoffrea or anyone in the testing team. They can put you in contact with the JIC. You can always email myself or Francis, and we'll be happy to provide that information if you're interested in kind of working on a specific campaign. I do want to set some expectation though, because sometimes like people are like, oh, can you work on a campaign in this small little area? Like we do have to kind of focus our time. So to the extent possible, we're driven again by that data and where the need is first and foremost. But obviously we want to continue supporting, whether it's through graphic design or other things that we can do to support the community message in that. So we'll always be willing to provide as much support as we can, just tempered with that expectation. We may not be able to do like full-blown campaigns for every single person that wants it, just because we do have to allocate our resources.
Okay, and then another, because it looked like we're gonna have to call you back to do some other. One of the things is about like billboards, and I know I was on a conversation similar, and Kathy brought it up about putting it up on the buses. Have you all did that? I think I have seen it on the bus with the MTA. And how can we get some of these campaigns in neighborhoods that have high concentrations of the different groups, you know, like the 8, having maybe the kind of Asian, or the 54, or different stuff. So that's what I want to know. How can we do that?
Yeah, great question. So for each one of these campaigns, I just gave you the high level, like here's what the look and feel is. There's a whole other strategy below that of all the different mediums we're using to actually push the message out. And so we're going to be, especially going into this Labor Day weekend, we're going to be on bus shelters, billboards, the social media, streaming radio. We're going to be on radio thanks to, you know, the great work of the African American Arts and Cultural District, putting together like a great rap video that we're going to be trying to push out on radio stations. So there's like, we're utilizing every single format possible. And even I heard Kathy mention, you know, the PA system and the MTA, like we help refine those messages too, which are also going out there in multiple languages, I believe on our buses and at our stations. So it's definitely hitting every single channel that has been mentioned this so far on this call. And again, we want this only to be the beginning. And so you'll see different campaigns in different neighborhoods because we do target it. So we're able to kind of geofence on a social media standpoint or a distribution standpoint of how we're pushing out messages into different neighborhoods and communities. Sometimes you'll see overlap depending on the populations that are within different communities. Sometimes you'll see differences in terms of language based on the medium. So, you know, for the Chinese papers, we're obviously going to be pushing the Chinese campaign and those messages in language. Similarly, for, you know, the Latino community, we're going to be pushing in the Spanish papers and television and radio in their language. So it's all a mix of everything that was mentioned. And we look at bus routes to where people are going around. So that's all part of our overall strategy.
All right. Thank you, Tyrone. And I think we're going to need you for a more extended period.
Sure.
So hopefully you can allot 15 minutes next week just for a few follow-ups for this.
Of course.
And thank you so much. You have any parting things, because I'm going to call him Veronica Shepherd next. Any parting things before you leave? Like, keep your mask on this.
Well, yeah, I mean, obviously all the usual messages. I don't have to say that because you've probably heard that enough. But just, you know, thank you, because all of you have been really holding on the fort across the city. And I know it's taking time for us to kind of get around, and it will take time for us to get around to working with everyone, but we do want to work with everyone to get similarly culturally competent campaigns out across the city, hitting every neighborhood and population. So we appreciate all of your work, and then also your help in supporting the work to get the word out. So looking forward to further partnership.
Thank you, Tyrone. Veronica Shepherd, I apologize. I did miss you on accident. So Veronica, if you can share the work you've been doing that.
Thanks, Geoffrea. No worries. You know, I wasn't going to let you forget me, so I'm okay. I don't take it personal. So there's a couple of things I think I can add value to this conversation. One, for the past 4 weeks, we have been doing some data collection at each survey site that we're at. I've been doing it at Western Addition, Leola Havard. We started at True Hope. And we've been asking, how did they hear about it? This is around outreach. How did they hear about this event? When? Is this their first time? Total number of people in their household. How many in the household have been tested? Zip code, age, gender, and ethnicity. I'm going to be having all this data collected. I think it's going to inform you a lot about what we're seeing out here to kind of add to the outreach effort. We do not see a large population of the people we're specifically trying to target. And I've been seeing it at week to week at different sites. Specifically, when I saw the Tyrone do the maps with the census tract, I happen to live in the highest census tract in the Bayview. There is no marketing or outreach going on in our communities. In addition, today, Tracy Senegar Shaw and I were headed over here to Western Addition, and Dog Patch on the walls across the street from Phil's Coffee has these amazing pictures that we're going to share with you all of African Americans wearing masks with data, percentage, why it's important. These kind of messages should be posted on billboards up and down and around our communities, because it shows just everyday African American people with the messaging about why it's important to wear masks and social distancing is important, and we'll share that with you all to look at for outreach purposes. Lastly, I also want to bring up, I don't know, Monique, I heard you say earlier that there was no information about what happens after your COVID test, but here and at the last sites we've been at, we have a blue booklet. Somebody's been sitting at the table, and every time you finish up your testing, you come through, you get a care kit, you have somebody give you this booklet that says after your COVID-19 testing and share with you the information that is available prior to them doing a survey and getting a grocery bag. So I don't know if you didn't see it here. We did have it at True Hope. We've had it at the last 2 or 3 testing sites, I think, when they first started printing this. And I know they're trying, it's only in English right now, and they're working it on making it in multiple languages. But I'm more than willing to share this data. It's going to help guide how we can do better outreach in the communities that have the greatest need. That's all for me.
Thank you so much, Veronica, and the work that you do at the sites. Definitely you, Dr. Mo, I'm looking, so many others have like 20 plus testing sites on your tool belt. You all are pros at these sites. So thank you, community. We have 2 minutes left. So I want to remind everyone that next week we will be again presenting the data, the hotspots, the new testing sites. We do have a month-long testing site, and I will, when you get the notes from Dr. Fuchs, it'll also have the updated community testing sites. Please share it far, social media, mail it, text it, so you know, because we did work hard to have a month-long calendar. And we will be covering school reopening and learning hubs, because some kids from private schools may be going back. San Francisco Unified School District will have information on that for you all to share in the community next week. Thank you all, and please share the invite to other community-based organizations that or community stakeholders that you need, that you all feel should get this information, because this is our most transparent meeting that we have weekly from the CCC. Thank you all.
Thanks so much.
Geoffrea, a quick question. Can you please reshare the month-long calendar? Oh, thank you, Jonathan.
Yeah, and I'm gonna send it with Dr. Few notes. So
Okay,
I'm
thank you so much. Appreciate you.
Yeah,
Thanks,
no,
Geoffrea. Can you send me a copy of that? Because I've got past faith leaders who want to get it out this weekend.
yeah, I'll do that. I'll do that right now to you both. But people who I don't have emails, they'll get it in the group.
Yeah, because I think we also want to make flyers for them. And so I just want to coordinate on that.
Okay. And then we can talk offline. I'm about to send that email.
Thanks. Monique, if you make flyers, can you send me some as well?
That's what I was going to try to, I'll get at you.
Awesome. Awesome. Thank you. Bye, ladies.
Thanks,
Bye.
Geoffrea. Thanks, Amelia. Thanks, John.
Thank you, everybody.
Y'all are rocking it. Have a beautiful weekend. Stay safe, everybody.
See you at Carnaval.
Thank you for joining the COVID-19 learning community. Questions or needs, please contact equity-neighborhoods@sfgov.org.